Hi, welcome again to the section of cardiology. This is Dr. Jaitly. I'll be discussing a follow-up what we discussed in the previous couple of EKG sessions. How does each condition affect the heart, and what does it show up on the EKG when these conditions are present? Now let's understand one condition at a time. Like we mentioned, EKGs are normally ordered by the doctor. It can be done very smoothly in a matter of a couple of minutes. Normally it's the nurse or technician who does it. It's totally painless, it's benign. They put some leads and some paste on your chest and on your arms and legs, and the strip reads off from a computer or a laptop, and the doctor gets to make an interpretation of your heart pace or your heart rate, and then determine what the causes are or what the effects are on the heart, and then treat or order further testings. Okay, so hypertension, for instance, now that is considered as high blood pressure. That means the pressure going through the aorta is high, and as a result, the left ventricle, which as we know is the booster chamber, that starts hypertrophying or added muscle weight. So when it adds more muscle weight to push against a high pressure, that's not a good thing for the left ventricle because it's working or overworking. It's like you and I, we all work for 8 hours, but if you tend to work for 10 hours consecutively or 12 hours and do overtime, periodically it's a good idea to do some overtime. You make an extra money, right? But then the chances are if you're going to be doing overtime a lot, it'll affect your health. It'll affect your sleep pattern. It'll affect somewhere down your social life or your family life, etc., etc. So the whole point is that, again, so the heart needs to work but not overwork against that high pressure. And that hypertension can reflect in the EKG form like this. Look at this. This is a normal pattern on the blue strip, but on the red strip, you see how the voltage is very high? Boom, boom, boom. So these beats are very, very powerful because now obviously this chunk of heart muscle that has been added because of high blood pressure is now giving high voltage, we call it. Like, remember, the voltage is the unit of electricity that's traveling through the heart. So that's how it reflects on the EKG. Diabetes patients will have microvascular disease, and therefore it becomes a very inefficient pump. And as a result, the vessels within the heart that are supplying the heart, remember, heart supplies the body, but heart has its own supply, and those supply vessels can suffer damage. And as a result, it can show up on the EKGs as a scoop. We call it a scoop that develops like this, for instance. That's a scoop. High cholesterol, similarly, will also cause angina or chest pain or heart attack. And that results from the clots that develop in the coronaries or the arteries that are supplying the heart. And so that supply system of the heart blockage leads to a heart attack or angina. And that can be also reflected here. Palpitations, for instance. Now, you see how this beat goes? Beat, 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 and then there's a pause, and then there's an abnormal beat in the opposite direction. So that's called palpitations, or sometimes we call them skip beats. Now, here's a skip beat. This is a skip beat or a premature beat. So just familiarize with these terms right now as we go on to the details later on during the session, but the whole idea is wanting to have you familiarized through this strip. What various conditions can do and how it will be reflected on the EKG, and also how it will be reflected within the heart. Drugs, smoking, and alcoholism, these are terrible habits, and unfortunately these are terrible poisons, and they affect the heart. That's the engine of your car, and the engine of the car goes bad. What good is the body then, right? you can keep the body, but then the engine is not going anywhere. It's not taking the car anywhere. So you need a heart transplant then. So we don't want to go there, right? We'll talk about that at a later time. The whole idea is wanting to see how all these poisons that affect the heart or show up on the EKG, and they cause a combination of all the above changes we just discussed, sometimes leading to a very serious condition called heart attack or even heart failure, we call it. And therefore, these conditions are very, very important. Anyway, I thought hopefully this was helpful, and looking forward to doing more detailed presentations later on. And stay tuned. When you go to see a doctor, make sure you ask some of these pertinent questions, and hopefully you learn. Thank you.